Hello and welcome. I'm Dr. Fiona, a sexologist and a urological surgeon, and today we're addressing a question that many men ask, especially those managing high blood pressure. Does lisinopril cause erectile dysfunction? It's a valid concern, and in this video I'll give you a clear, science-backed explanation so you can understand exactly what's going on in your body. First, let's briefly talk about what lisinopril is. Lisinopril is an ACE inhibitor, short for angiotensin-converting enzyme inhibitor, and it's commonly prescribed to treat high blood pressure and heart failure and to protect the kidneys in people with diabetes. It works by relaxing blood vessels, allowing blood to flow more easily, which lowers your blood pressure and reduces strain on your heart. Now, here's the link to erectile function. Erections depend heavily on healthy blood flow. When you become sexually aroused, your body releases nitric oxide, a molecule that tells the blood vessels in the penis to dilate. This dilation allows blood to rush into the erectile tissues, leading to an erection. Anything that interferes with this process, whether it's physical, hormonal, or psychological, can lead to erectile dysfunction, or ED. So the big question is, does lisinopril interfere with that process? Well, the answer, based on current research, is no. Lisinopril does not typically cause erectile dysfunction. In fact, compared to other blood pressure medications, lisinopril may actually have a more favorable impact on sexual function. Some studies even suggest that ACE inhibitors like lisinopril could improve erections by enhancing endothelial function, that is, the health of the inner lining of blood vessels, and by increasing nitric oxide availability in the body. One study published in the American Journal of Hypertension showed that men who switched from beta blockers or diuretics to an ACE inhibitor like lisinopril often experienced an improvement in erectile function. That's because unlike certain older blood pressure medications, especially thiazide diuretics and some beta blockers, lisinopril tends to preserve rather than impair the blood flow mechanisms necessary for a healthy erection. However, it's important to acknowledge that some men still report issues with erectile function while taking lisinopril, but in most of these cases the medication itself may not be the true cause. High blood pressure on its own can damage blood vessels over time, including those that supply the penis. Stress, anxiety, and underlying conditions like diabetes or low testosterone can also play a role. And sometimes it's the combination of medications, rather than lisinopril alone, that contributes to the problem. If you're experiencing erectile dysfunction and you're taking lisinopril, don't stop the medication without talking to your doctor. Instead, have an open conversation about what you're experiencing. Your doctor can evaluate whether your ED is due to the medication, the condition it's treating, or something else entirely. They might adjust your treatment plan, explore other medications, or investigate other causes of ED that are unrelated to lisinopril. It's also worth mentioning that lifestyle changes can have a significant impact on both blood pressure and erectile health. Quitting smoking, losing excess weight, getting regular physical activity, and eating a diet rich in vegetables, healthy fats, and natural nitrate containing foods like leafy greens and beets can all support both heart and sexual health. Okay, so in conclusion, lisinopril is not a common cause of erectile dysfunction. In fact, among blood pressure medications, it's often considered one of the more sexually friendly options. But every person is different. If you're concerned, speak with your healthcare provider. With the right approach, it's often possible to manage your blood pressure and preserve, or even improve, your sexual health. Are you taking this medication, and what dosages are you taking? I'd like to hear from you in the comments. And as always, thanks for watching. I'm Dr. Fiona, and I hope this information empowers you to make confident, informed decisions about your health. Be sure to like, share, and subscribe if you found this video helpful, and feel free to leave your questions in the comments below.